Hi friends, I am Dr. Swapna Chekuri from Hyderabad Women and Fertility Center. Welcome to my channel. So today let us discuss about renal disease and pregnancy. So usually in a pregnant patient we usually check for the renal function test, and definitely with already pre-existing renal disorder they'll have elevated urea levels, creatinine levels and uric acid levels. So if the disease is in a milder form, then no issues at all. Their pregnancy will go till term. If it is a moderate disease, then definitely chance of preterm labor will be there. And if it is a severe disease, then chances of oligohydramnios and chances of IUGR baby, small baby, and chances of developing preeclampsia, severe hypertension will be there definitely for the baby. At the same time, for the mother, whatever the disease renal stage, the renal disease stage, that will progress further and she can land up with end stage renal disease. So that's the reason the patients with the renal diseases, they come under high risk category. For the other individuals we usually ask for monthly once consultations, but for these individuals we usually call them every 2 weeks for antenatal checkups, and throughout their pregnancy we need to monitor them closely, and throughout pregnancy they need to continue the folic acid. At the same time we usually put them on aspirin or ecosprin. It's a blood thinner, just to improve the blood flow, because already it's a known risk factor to develop oligohydramnios and IUGR. So to combat that problem, we usually start ecosprin in the first trimester itself, and then already who are on some medication, if they're planning for pregnancy, better consult with a nephrologist so that they'll change the medication whichever is suitable for the baby and the mother as well. And throughout pregnancy we need to monitor closely with a combined consultation of an obstetrician as well as a nephrologist, and every monthly we usually check their renal parameters whether they are okay or not, and we usually ask for an ultrasound abdomen to see how her kidneys are functioning. And at the same time we need to monitor closely the fetus growth as well as about the liquor as well. And then especially at the time of delivery we need to take utmost precautions, because these are the candidates who can land up with postpartum hemorrhage or peripartum hemorrhage, because during delivery they might bleed more. So that's the reason when we are planning for delivery we check for their coagulation profile, we keep all the precautions ready and then go ahead with the delivery. And after delivery it might take at least minimum 3 months postpartum for all the changes to become normal, and throughout these 3 months also she requires close monitoring by an obstetrician as well as a nephrologist, and she need to maintain the fluid balance, electrolyte balance, and we'll be rechecking the renal function test even after delivery as well. And by taking all these precautions, both the baby and the mother will be in a safe condition. And in few situations, in spite of taking all precautions, if the BP is not under control, if the mother is going worse in her renal parameters, then that's an indication for the termination of pregnancy even before term. Okay, so friends, if you find the video is good, if you find it's informative, please like my video and share with your friends and needy people. Thank you.